So we're going to talk among ourselves for a few minutes, thinking about not only what we've said among ourselves, but what's been said before us. And one of the things I'd like to do is to take up Mark's proposal this morning that the gates are open for new research ideas and new research strategies. And I'd like to, you mentioned implementation research. What would you like to see happen?
Well, I think we have heard today opportunities to intervene for intimate partner violence. We've heard suggestions about ways to affect early childhood trauma. I think that ultimately we have to, and with regard to urban violence that we're talking about, we have got to look at programs that have actually been put in place and understand how you replicate those programs in other settings, how you identify more intermediate outcomes that might not be these gross outcomes that are at the level of homicides, again, or shootings, but how you begin to understand some of these other processes that are happening in the lives of folks. Like, can you affect the likelihood of post-traumatic stress development through a particular intervention? The other piece I would say about opportunities for research, I think it's really reflected here, is that I think there has not been enough collaboration between the public health, and criminal justice community on these things, in part because we speak a slightly different language on this, but we find ourselves always, and certainly in the intimate partner violence world, we find ourselves looking at the same problems from different perspectives. And to the extent that we can incentivize research that builds on those collaborations and bridges the different languages, I think we will make headway. And I think Department of Justice has done some of that successfully.
Same question? So, I think
do you consider ceasefire implementation research, by the way?
Yes, sure.
Could you explain that to me?
Well, what you just heard is stupid simple. Right? It's very small numbers of people at the kernel of the problem. The sort of community moral voice and outreach and support piece is really a way of trying to craft collective efficacy around this very special population. We know that they don't have any idea what their legal risks are, particularly in the light of law enforcement discretion. They can be walking around with a federal target on their back and they don't know it until the feds come. So the logic of this is not complicated at all. What's turned out to be really difficult is getting people to understand it, to apply it, to keep it going. And
community people.
No, the community people are not the problem. It's the professionals that are the problem. It's the people who get paid to do this that are always the issue. And figuring out how to make this work across the professional agencies and bureaucracies that need to be part of it to keep it going has been the absolutely most vexing thing.
Karen?
Yep. So I'll mention two. There are things that we're sort of tooling up to work on and very excited about. Alcohol. We, under federal law, if you are addicted to or an unlawful user of a controlled substance, you can't buy a gun forever. But distilled spirits and beer and wine are specifically by name excluded from the list of controlled substances. You can drink like a fish. You can have any number of misdemeanor convictions for driving under the influence. And if you have no felony convictions, you can buy as many guns as the law allows. Insert here what we know about alcohol abuse as a risk factor for violence, and what are we doing? We should look further into that. One more very quickly. I've talked a lot, about preventing high-risk people from buying guns. What about the people who buy guns legally and then commit crimes and become prohibited persons, A, and B, by virtue of having committed that crime, establish themselves as being at high risk for committing another crime in the immediate future? What happens when we take their guns away? That's actually being attempted, and we should find out if it works.
We had a discussion periodically today, and particularly from Professor Huseman, about contagion. And I wonder what your thoughts are about violence being a contagious disease. What do you think about that, John?
I think from the perspective of trauma, we know that trauma is contagious. We know that people who are not directly affected, who are bystanders, I know there are folks in this room who have done this work on natural disasters and others. And so we know that there are entire communities that are traumatized and therefore, and disproportionately traumatized, and therefore at higher risk for some of these behaviors and poor outcomes. What we do know is that the disparity is how we address those. The benefit of the focus on mass shootings has been that it has brought this issue of firearms to light. We can also learn a lot by what was done for communities in the aftermath of that. And rather than, as some people have wanted to make this more provocative, asking the question why we haven't done those same things in the inner city, asking what if we did mobilize resources for young people in schools who have been exposed to similar types of violence or who are exposed to this chronic, unrelenting, toxic stress of losing classmate after classmate. We can do a lot if we begin to, again, identify this as a communicable, in the sense communicable, contagious disease, but trauma being, exposure to trauma and the consequences of that being the agent.
And it's reciprocal, right? So the wisest gang outreach worker I know says gang members are married to their enemies. And just to continue to build on this idea, if you go and talk to any young man in these neighborhoods who's carrying a gun, 8 times out of 10 he will say, I'm doing it because those guys over there are trying to kill me. And if you go talk to them and ask them, they will tell you exactly the same thing. And this turns out to be why so much of both law enforcement and preventive measures don't work. It's because we almost all focus on individuals. And you can teach this kid anger management. He's not angry, he's scared. And if you don't protect him from the people on the other side, then he's going to perforce keep on doing what he's doing. And I think the most exciting possibility in here is to recognize the extent to which non-law enforcement interventions can do that work. The more focused you are on these microdynamics, the more you can get in, and where a cop will be refused 3 mothers of murdered children talking to that guy's mother will have an enormous influence.
And to pick up directly from there, if they survive, both sides end up in an emergency department like mine. Sometimes at the same time, and our struggle is how to keep them apart. But I continue to be intrigued about the possibility of using clinical settings as a way for identifying people for whom such interventions might be helpful, whatever the interventions are. I don't think the research on that is very good at the moment, and we need a lot more.
I'm not sure if Jens Ludwig is in the audience. That Jens is one of the new fellows and is the principal investigator of Moving to Opportunity, which is a housing relocation program supported by HUD and NIH. And the experiment has been highly successful despite some sampling artifacts that have to some extent reduced generalizability of the study. But one of the findings is that, so this is a 3-arm experiment in which there's a control group that stays in public housing, concentrated poverty, one experimental group that moves to neighborhoods that accept Section 8 housing, but they're on their own to find those housing, and a 3rd arm of the experiment that gives people Section 8 housing with supports, with real estate supports and social work supports and so forth. And the results of those experiments on adolescent mental health have been disconcerting. Well, they've been positive and negative, I should say. They've shown highly beneficial results for girls and negative, harmful effects for boys. And I really would like to see if Jens would comment on that in the question and answer period, but I think it's time to turn it over to the audience. So, would you start?
Sure. Thank
Identify
you.
yourself.
Yeah, sure. I'm Nikki Lurie. I'm the Assistant Secretary for Preparedness and Response at the Department of Health and Human Services. And I have a somewhat rhetorical first part and then a serious, more serious second part. So recently, in the last couple of weeks, I was approached by one of my very bright, talented mentees who wanted some advice. He had wanted to submit a grant in response to the latest NIH RFP on gun violence. And he said to me, everybody I talk to at my institution, my chair, one of my deans, my mentor, all tell me this is a career killer and I should not do that. What do you think I should do, Nikki? So I'd like to hear maybe a little bit from the panel, but challenge us in the audience to think about the institutions that we're from in this day and age and how we want to respond to that.
Sure.
My second question is that because of the visibility I get into what happens in the country, one of the things that I am stunned at is not only the number of violent shootings that happen every day and every week, but how many schools go on lockdown every day or every week, either because it's real or because somebody thought they saw a gun or whatever. So this means that thousands, if not millions, of children are traumatized one way or another, even if they haven't seen somebody shot and killed. What should our response be for those schools and those children and their families?
Karen, maybe
First
you
part?
can answer
Yeah.
the first part. How did you survive?
We found money where we could. From when CDC money dried up, and as you guys know, it wasn't CDC's decision, several private sources stepped forward, and several of them are still providing funding to us and others. The National Institute of Justice had a program that continued to operate until not too many years ago when its program officer retired. The program closed. The program is again open. There is potential funding available from NIH. There is funding available from NIJ. There's a brand new RFP from the Fund for a Safer Future, a coalition of private sources that is going to be making grants. So there's money available. But I want to take on what the mentoring that other people provided your mentee. I'm just angry. So first off, my career ain't dead. I'm still here. There aren't a lot of us. It's the way it was in the mid-1980s when the curve sort of took off. But I have two things to say. A, it's not going to get better if the same dozen to 20 of us around the country are doing it. We need fresh blood. Look at us. We're old people, or we're getting there. We need young, smart people to join. And I would add to your mentee, death threats come with this business. There are some other costs to consider. But by golly, if the good people don't take some risks, the bad guys win.
So who wants to take the lockdown question? Have you had any experience with that? John?
I think it's an important question, and it's kind of the way we live now, making sure that kids are safe. I think a trauma-informed perspective might make those exercises actually reassuring to children. That caring adults have thought through what will happen if something bad happens. Children know that they're shootings. It's not as though they don't see that on television. And so I think when intelligently done, and appropriately done, and it takes into account the fact that many of these young people, in some sections, see this on an everyday basis. In some ways, it opens a conversation about what is these rare events that we have reacted to happen against the backdrop of everyday events for some children. And to the extent that we understand all of these as traumatic, we'll make sure that teachers are better prepared to talk about trauma, to look at children's behavior and not ask what's wrong with this child, but what happened to this child. I think it may actually be an opportunity for us to think differently about how to talk about safety to children and to teachers.
Great. I'm glad to know that you're not tired. The lines are getting long, so I'm going to ask that you keep your questions brief, and we'll try to give responses that are brief to keep the interaction
Joel
going
Alpert,
on.
historically of Boston, still in Boston, but as a benefit of maturing, a legal resident of Florida. You make reference to the bad guys. I suspect an honor that I share with many in this room is having been on the NRA enemies list that came out in September 2012. Never got any death threats, but I was certainly on that list, and I've added it to my CV. Maybe that will help recruit others. But thank you for a powerful, powerful session. The Florida story is about 2 years ago, the Florida legislature passes the Gun Owners Privacy Act to prohibit physicians, especially pediatricians, from asking in the confines and privacy of the office, do you have a gun in the house? First with prison, then with severe financial penalties, and finally with the Board of Medicine in Florida disciplining the offender. Almost immediately, the Florida Pediatric Society, the American Academy of Pediatrics, the AMA, the ACLU, and the Ropes and Gray law firm filed an injunction against the bill, which was ultimately declared as unconstitutional by the judge. And I do not have a late follow-up, but the governor of Florida, Scott, said he wasn't going to appeal it and cost the state money, but he has appealed the court. Maybe you know the answer was supposed to come down early summer. It was beaten on a First Amendment issue. The NRA lost on this one. I think a commonality, whether it be the tragedy of the inner city, the mass shootings, the numbers of children who die every day in domestic violence events, requires that we fight back. Everywhere, maybe one day we'll have not only a Mothers Against Drunk Driving, but a Mothers Against Gun Violence. The same bill has now been reintroduced in at least 5 other states. And I say heads up to all of you, don't take anything for granted, but fight vigorously because the outcome is so destructive if that kind of legislation were ever upheld.
Thank you, thank you, thank you. Well, shamelessly, again, I have to point out that one of my students is about to answer a question. Arturo.
Hello, Arturo Cervantes. I head the National Center for Injury Prevention in Mexico. And first of all, commend the IOM and the panelists for an excellent discussion. But my question and request for comments, could we? Sorry. Well, as has been discussed, violence is contagious, and the hardest hit area and region of this global pandemic happens to be your southern neighbors, Central Mexico, which is part of North America, but Central and South American countries as well. And over the last 4 or 5 years, violence, specifically homicidal violence and delinquency with firearms, has peaked at incredible levels. Some cities have rates for youth, for young males that are very similar to what was described today with the African American males being completely off the charts. That is happening. But we are here at the Institute of Medicine, and this challenge to the audience lies precisely in what Mark was discussing this morning regarding the bioethical implications and the policy implications, both for medicine, for the Institute of Medicine, and for us in public health who are advising the nation, because the issue of the gun control discussion that is being had in this country is not at all considering the enormous toll that the policies regarding gun production and commerce have for, just think your southern neighbors, for example, where homicide has become the first cause of death from 10-year-olds to 50-year-olds as of 2010. So back again to this NRA lobby and this discussion, I'd like to for us to think and challenge the audience regarding the implications outside our borders of our internal policies. Thank you.
Thank you for the comment. Do you have any comment?
Actually, just very briefly, agreed. I want to build on it. Much has been said today about collaborations. speaking about policy development, not so much research here, one of the collaborations that we all have largely ignored is with people who own firearms. You just made the comment about our firearm policies. It's important to keep in mind that firearm policy in the United States does not reflect the priorities of the vast majority of firearm owners, let alone people who don't own firearms. On many particular issues, such as comprehensive background checks and so on, support for policy and intervention, policy reform is only slightly lower among people who own firearms than among people who don't, and is actually quite high even among self-reported members of the National Rifle Association. There is common ground there. We simply need to expose it.
Yes, my name is Ruth Lubick. I'm a nurse midwife. I'm also a MacArthur Fellow who was given that award for establishing the first freestanding birth center in the country in New York City in 1975. When I got the MacArthur, I came down here to prove that a midwifery model of care could really make a difference in the lives of low-income African-American families. And if we were able to do it here, it could be done anywhere in the country. I operated on the principle that it's not their fault, it's our fault. We don't treat them like fellow human beings. And so we've been able in Ward 5 to reduce preterm birth, low birth weight, and cesarean section. We also have made use of social supports. We have a freestanding birth center, social supports, and early childhood education from 6 weeks to 3 years of age. And my message to you is you need to get the mother in pregnancy. We had a question about spanking children. We've all seen black women hit their children on public transportation, so forth. So they're taught violence very early on. And yet we, in treating women like they're fellow human beings and raising their self-esteem, then they're ready to listen to, well, how can I parent? There is a program coming from Los Angeles called Effective Black Parenting, which we have taught to the parents, and it seems to work. I have no data on the outcomes on all this, but, and there's one more thing that I wanted to ask, particularly Mr. Kennedy, and if he's heard anything about hip-hop saves lives and hip-hop pedagogy in public schools in the grades, because that's going on in New York with evidently some success. There will be an event at Carnegie Hall on Sunday, November 3rd, and it's called Kids Helping Kids. And what the pedagogy is teaching kids how to help each other. And so there are things going on out there in the way of prevention. I can't comment on guns. I don't own a gun. I don't want to own a gun. I'm 86 years old, so I should make some of you feel a little better. But I just want to repeat, you have to get the mother in pregnancy. You have to teach her how to mother. Because if you don't teach her, if you don't give her that opportunity to raise her own self-esteem and so forth, she's going to do what was done to her.
Thank you.
So, yes, I hear that. I also want to raise a very strong note of caution about any explanations or any interventions that say it is this community, because in a most fundamental and material way, it's not. Just to go back to my central point here for my part of this panel, yes, it is absolutely right that this gun violence is concentrated by geography and unfortunately by ethnicity and race in very particular neighborhoods. It is also the case that nearly everybody in those neighborhoods will never shoot somebody, will never hurt anybody. This is one of the problems with approaches that have proceeded by saying we have these risk factors. If the risk factors were as strong as we thought they were, we would be hip deep in bodies. And as bad as it is, it's not that bad. the neighborhoods I work in, all the kids, all the families, everybody's at risk. And not only does the community not kill everybody, most of the young men don't kill anybody, most of the young male criminals don't kill anybody, most of the gang members never kill anybody. So we want to be very, very careful about saying it is a community issue. And Andrew Papachristos is going to be on the next panel, is going to, I think, present some information that basically says within the communities that present in this way, there are really two communities. There's a very large community that is essentially immune from these issues, even though the risk factors are all there, and a very small, very distinct community at which people are at astronomical risk. And we need to be very clear with ourselves that we're not impugning a people for something that a people is not doing.
Can I just add to that? And really today, I think we've touched on a lot of subjects. The fact that race, when we use it, is really proxying most of the time for something else, and usually poverty. So we're hopefully talking about impoverished communities, or we're talking about communities where racism has played out in a variety of ways. And even in Dr. Adler's work, the biology of disadvantage, how it is that being disadvantaged and poor changes your biology in ways that are very significant, is a part of this conversation. And it moves us away from racializing this issue and rather towards something that gets to what race is showing in that moment.
Ms. Ford?
Thank you for remembering my name. I feel special. My name is Erica Ford. I'm from New York City. I run the I Live My Life VIP pilot, which consists of the Cure Violence model, formerly known as Ceasefire. I also sit on Ray Kelly's advisory committee, and I wanted to say I'm glad that I'm here, and at the same time, I'm intrigued to the question that Darnell raised of, you know, we do a lot of study, but what is the correlation between the study and the people on the ground who, just like Christopher Columbus discovered America, the people on the ground are already there dealing with this issue. And I never really see a correlation between these studies and the people on the ground and making them a pivotal part of the development of the outcome of the study, you know. And I think that I would like to charge IOM to work closely with people who are on the ground on the issue of violence throughout the United States, and even create something that you were just saying in the beginning with the community evidency, which seems like a correlation of different models that work cohesively, because if any of us had the answer, we wouldn't be here today. So obviously we need to work together as a more cohesive body.
Absolutely. Absolutely.
Hi, Margaret Moss from the Yale School of Nursing, but also here to give voice to another group. I'm also an enrolled member of the 3 affiliated tribes of North Dakota, the Mandan, Hidatsa, and Arikara. And as you're talking about context to policy, I also I appreciate Dr. Campbell mentioning Indigenous women. I don't know if people realize that Indian women are killed at 10 times the rate of any other of the next closest group, 10 times. A lot of this has to do with policy, so as you're talking context to policy, it's the confluence of varying laws. Some of them are just about to be changed, but it's going to take a lot of time. And I'm sorry, the second speaker, it just struck me with the story of the young man, because as you go around Indian country, you can hear Indian girls saying things like, when I get raped, I'm going to do X, Y, and Z, not if. So I appreciate your presentation. So I just wanted to make sure to give voice to this. And just, my question is, have you any of you any experience or thoughts about the rural context versus the inner city?
How do I get to that rural?
Yes. And in fact, we are partway into the first application of the set of ideas that I presented in Indian country in New Mexico. And so, you know, you are absolutely right. Everything is turned up to not 11, but 12 or 13. What's interesting is that you find the same core underlying dynamics. They're more extreme, but they're all there. And just to be very brief about it, you find the same extraordinarily lopsided distribution of offending. You find the same desperate desire for the community to intervene. And you find this miraculous willingness of even the guys we think of as the worst offenders to listen and to accept help. And it's too early to know where it's going, but it feels very promising.
Well, we have to end the panel. I want to thank the panel for being insightful and engaging, and the audience to be tolerant and share your insights with us. Thank you very much.
Thank you very much. That was an excellent panel, and we are going to now have our final panel, which will focus more on intervention and prevention. Alan Leshner was supposed to be moderating this panel. He had a death in the family that took him away, and Arthur Kellerman very kindly agreed to step in to moderate. Art is Dean of the F. Edward Hebert School of Medicine at the Uniformed Services University of the Health Sciences, and he will introduce and moderate the panel.